Hi, Dr. Yass here. In this video, I want to discuss the harsh reality that for the global population trying to seek an answer to how to end their pain and return to a happier, more fulfilling way of life, there are major impediments. And I am talking about societal impediments, organizational impediments that the global mechanism establishment for addressing chronic pain 40 years later continues to be this idea that the MRI is the gold standard for identifying the cause of pain, and therefore whatever is found on the MRI is the actual tissue in distress eliciting your pain. So for 28 years now, I have been trying to make people recognize that this is in fact a completely baseless concept, that in fact there is actually no theoretical, clinical, or scientific evidence to say that the MRI actually identifies the cause of the pain. And I have an entire method that can show you that in fact the idea of diagnosing through diagnostic tests is baseless, while the idea of interpreting the body's presentation of symptoms is exactly the correct method, and in fact is the way the body wants you to identify the tissue in distress eliciting the symptoms, which is why the body elicits those symptoms. So I recently came upon, and this is the purpose of this video. I came upon a review of the book that I put out in 2015 called The Pain Cure RX. And this review was done by, this is in the Pain News, and it's done by the British Pain Society. Okay? So this is the Pain News from the British Pain Society. So the British Pain Society has decided to review my book to help people determine whether there's validity in the book and whether it should be utilized as a means of helping people resolve their pain. So I wanted to read to you what they said about the book. And of course, as is usually the case, this is put out without my knowledge, of course. And so this just simply festers what they say out to the masses. And so if you were to say, read this before you had the opportunity to speak to me or to get information through the mechanisms I have made my information available, my YouTube channel, Facebook, Instagram, books, blogs, all of it, this would deter you from even being willing to investigate whether the method is effective. And so I would like an opportunity, and I'm never really going to have a chance because whatever is said without my acknowledgement. I'm simple. Obviously, people don't say, hey, we're doing a review about your book. If you'd like to say something about it or respond, by all means do so. This is just the way life is. So I just wanted to get on record, if you will, my response from a technical, logical, scientific perspective regarding what they said in their review of my book. So the book, the review, oh, I see, it's by a physiotherapist. Oh, I didn't even realize that. It's not even by a doctor. This in itself should scare you. But here we go. The Pain Cure RX is intended as a self-management tool for those people who are affected by persistent pain. Within this book, Mitchell Yass advocates his approach to managing persistent pain, which he refers to as the Yass Method. The Yass Method is introduced to diagnosing and resolving chronic pain. Mitchell Yass has a bachelor's degree and a doctorate in physical therapy. Based upon his experience, Yass has developed a book, The Pain Cure. It's not The Pain Cure, it's The Pain Cure RX, because there's actually another book called The Pain Cure, which talks about how to live with pain. So that's already a confusing thing. That book came out after my book. To challenge conventional thinking on pain. His argument is around the inconsistency in the pain that people experience versus modern forms of diagnosis, such as magnetic resonance imaging. Correct so far, imaging scanning. Yass disputes the concept of diagnosis solely by MRI scanning by highlighting inconsistencies in the pain people experience with differing MRI presentations. For example, people reporting high levels of pain when there are only minimal changes noted in investigations. Yass proposes that the majority of persistent pain is muscular in origin rather than structural. He believes that inconsistencies in people's pain experience with similar structural change seen with conventional investigation support his hypothesis. So they're trying to say that the entire basis that I'm saying that the MRI is baseless is the fact that there is a complete lack of consistency in the idea that there's some correlation between higher levels of symptom and higher levels of structural abnormality. That, in fact, it's irrefutably true that MRI show people with very limited amounts of a very small herniated disc, let's say, and massive levels of pain versus people who have massive herniated disc with virtually no pain. They're trying to pin my whole position on that one thing. That is complete insanity. Insanity. That is basically talking about the scientific concept behind why it is baseless. So let's talk about the theoretical concept why it is baseless. It is baseless because what is being said is that a herniated disc is found at the time you're having pain, therefore it is the cause of the pain. That is what is known as correlative theory, junk science. Everybody on the planet who knows anything about science knows correlative theory is junk science. I can say that opening my front door when the sun rises means opening my front door causes the sun to rise. That's how stupid, that's how baseless the idea of correlative theory is. Well, if you want to take the premise that since the herniated disc is found at the time you're having pain, well, I could find you have 2 elbows at the time you have pain. So does that mean having 2 elbows is the cause of your pain? Of course not. How about the fact that as many people with no pain have the same structural variations found in the same percentages as those with pain? How do you account for that? So there's a massive theoretical problem with the idea of saying that since the structural variation is found at the time you're having pain, that it is the cause of your pain. It is baseless. It's correlative theory. It's junk science, period. So it's a lot bigger problem than them saying that I've hooked my whole concept on the fact that people with little structural variation have a lot of pain, while people with a big variation have little pain. It's so much more than that. Probably the biggest problem with the idea of using the MRI is the fact that if a herniated disc were to cause a pain, then it should create pain in a specific place. All tissues create specific pains and areas of pain, and that's why the interpretation of those symptoms helps you identify what tissue is creating the symptom, right? That's the idea. There's a direct correlation. There's not correlation, it's causation. A specific tissue causes a specific symptom. The interpretation of a specific symptom causes you to know what tissue is creating it. That's the way it works. That's how the body has worked forever, right? So you're going to recognize there's a serious problem with this concept of diagnosing when over 28 years of doing this, I've established that in more than 99% of cases, the place where the person is actually having their symptoms is not the place where the structural variation that's been identified would cause symptoms. So if it's not at the place where that structural variation should be causing symptoms, how can you say the structural variation is the cause of the symptoms? You can't. It's impossible. These are facts, irrefutable scientific evidence. So there's theoretical evidence, there's clinical evidence, there's scientific evidence, and then there's reality. Wake up to reality. 130 million Americans suffering from chronic pain, 1 billion people worldwide. Why? Because they're so good at diagnosing the tissue in distress and resolving the distress of that tissue? Who would believe this nonsense? So it's more than that. So let's just keep going forward. The book takes the reader through the process of self-examination, diagnosis, and treatment of education and exercise. The proposed clinical assessment combines range of motion testing, muscle testing, flexibility assessment, palpation, gait, evaluation, postural assessment, and balance testing. In addition, he asks readers to consider the pattern of symptoms in terms of the activities that make it better and the factors which contribute to the symptom aggravation. From the assessment, Yass provides a reasoned guide to a number of common musculoskeletal conditions to enable readers to gain further insight to their pain problems. Finally, Yass guides the reader through special tests to confirm or refute possible diagnoses that are made through MRI scans. So at least it sounds like they've read the book. Part 2 of the book is concerned with resolving pain. This section of the book provides a number of musculoskeletal pain presentations with a number of associated tests to attempt to differentiate between them. Once a diagnosis has been achieved, the reader is then directed to the exercise section of the book where a variety of joint-specific exercises can be found to address the problem. Yass's theory of an over-reliance on imaging in the assessment and diagnosis of musculoskeletal pain is supported by a number. Let's listen to what they're saying. Listen to what they're saying. Yass's theory of an over-reliance on imaging in the assessment and diagnosis of musculoskeletal pain. Who's determining whether it's musculoskeletal pain? You? You can decide based on what pain you're having, whether it's musculoskeletal, whether it's neurological, whether it's from bone. Who's deciding that? Who's deciding that? How is there an assertion that the only pain that I'm addressing is musculoskeletal? The whole premise of the diagnostic model is to be able to identify what the pain is. And if it's bone, it makes a specific type of symptom. If it's nerve, it makes a specific type of symptom. And if it's muscle, it makes a specific type of symptom. Okay? So the goal of the method is complete diagnostic oversight to be able to know whether it's bone, muscle, or nerve. It's not just I'm deciding which of yours are musculoskeletal. I don't always try to just diagnose the musculoskeletal ones. I'm trying to guess every form of pain, wherever it is from head to toe, whether it's muscle, bone, or nerve. So it's an overriding diagnostic model to interpret symptoms as a way of identifying the tissue in distress. So he says, supported by a number, they identified numerous spinal changes on MRIs in patients who were asymptomatic. Unfortunately, this ideology fails to engage fully with conventional, here's the home run ball. This is what I want you to hear. Unfortunately, this ideology fails to engage fully with conventional understanding of chronic or persistent pain management. So they're saying that my method falls outside what is considered conventional understanding of chronic or persistent pain management. So you should take comfort in that fact, because the conventional understanding is doing so well for you. If anything, you should be jumping for joy that you're hearing something that's not conventional. The vast majority of you are tired of going to people that are conventional because the conventional has failed you so miserably. That's the point of the book. That's the point of the Yass method. I'm explaining why the conventional method has failed so miserably. Yass suggests that weakness is predominantly the problem for the majority of patients who experience persistent pain. It could be argued that weakness may be a component of a persistent pain problem rather than the sole underlying cause. What does that even mean? What does that mean? It could be argued. How could it be argued? How could it be argued? Because you just want to argue it? That's the answer? No, the answer comes from interpreting the body's presentation of symptoms. If the symptoms identify the tissue in distress as being muscle, then it's muscle. It's muscle. There's bullshit that goes on all the time that your muscle is in spasm because a herniated disc is pinched and impinging on a nerve, making the muscle is just ludicrous, ludicrous. So tell me, how does the person that say that, how do they differentiate when the muscle is just strained and eliciting pain versus when the muscle is supposedly magically strained and in spasm from a nerve being impinged and creating that. And by the way, what's the actual pathway that actually happens? There is none. It's made up. It's made up by the conventional mindset that is incapable of properly diagnosing you because they use a faulty mechanism known as the MRI. So they have to make up concepts. So when they, even if they're willing to acknowledge that there's a muscular problem, they're going to say that the muscular problem is coming from a herniated disc impinging on a nerve, and the nerve is making the muscle go. It's ludicrous, nuts, insanity. That's why you're still in pain. Exclusively discussing the physical aspects of a person's persistent pain fails to fully appreciate and understand the role of other factors, such as psychological and social situation. It is widely accepted, again, widely accepted. They like to say that, widely accepted by the people who are completely incapable of resolving your pain. That's who's widely accepting what they say? Right, right. So maybe we should look outside of what is widely accepted because it ain't working, right? It is widely accepted that both of these can act as a contributing factor to the development of persistent pain. So that's true. That's true. It's not the development of persistent pain. If you want to know what the development of persistent pain is, it's misdiagnosed acute pain. The pain that initially develops at the inception of distress of a tissue. Right at the beginning, it breaks down, it elicits pain. So if you were to be able to go to a proper diagnostician, say me and the Yass method, well, we would establish what tissues in distress. You would have the proper intervention to resolve the distress of that tissue immediately, and your symptoms would never end up outside of the acute phase. So why do you have chronic pain? Because you're getting an MRI, it's showing a herniated disc, stenosis, a pinched nerve, meniscal tear, arthritis, any of the crap that it shows, and that becomes your diagnosis, and all treatments follow that. The problem is that in 98% of cases, it's muscle. Muscle is in distress, eliciting your symptom. So as long as you don't identify muscle, it continues to elicit pain. Right above my head, that's the magic answer. Misdiagnosis equals chronic pain. Period. Period. Now, is there a psychological component to this? You're damn right there is. But it's not the psychological component that's festering the chronic pain. It's the result of the chronic pain. And you can see it in this. This is a classic example. I come in and I pinch you on your shoulder. Do you have a nervous breakdown? Do you panic? Are you hopeless? No. But let's say every 15 minutes, for every day going forward for the next 10 years, I pinch your shoulder. I assure you that you see me walk in that door and you're going to have a nervous breakdown. So what's causing the associated emotional distress? Is it the actual eliciting of pain? No. It is the inability of the process to be ended. It's the fact that the pain continues, right? It's not the signal of pain. It's the fact that it continues to go on and on that you eventually become anxious about it. You develop hopelessness, frustration, right? So to say that the frustration, the anxiousness, or the hopelessness needs to be addressed to make the pain go away, what the hell does that even mean? What does that mean from a scientific concept, a scientific construct? What does that mean? Where's the path, by the way, based on what they're saying? Can someone show me the path between the pain receptor aspects of the brain and the emotional aspects of the brain? There's actually a nerve pathway there. So just imagine if there was, how sick this would be. You stub your toe and you have a nervous breakdown. You want to crawl into bed and lay in a fetal position because you stubbed your toe. You get a paper cut and you think you want to commit suicide because there's a direct connection between the pain receptor aspects of the brain and the emotional, right? So that's what they're saying. That's what they're saying. So since they're connected, you need to address both sides. That's the only way. Does anyone think that makes sense in the planet? When you look at it from a scientific construct, clearly it's nuts. Nuts. But this is the British Pain Society. As they describe, this is what is considered the normal thought process. So within the narrative, Yass does provide the reader with an improved understanding of common, again, he likes to isolate myself, common musculoskeletal diagnoses that may have been given by health professionals along guidance about future expectations. It could be argued that by providing the reader with such information, the book could indirectly facilitate a modest reduction in anxiety felt by the reader. However, the book fails to deal with these issues specifically. So let's think about this. Everyone who's in pain, who's had chronic pain now for a while, let me ask you something. Do you think that you need to resolve your pain? Do you think that you simultaneously have to be getting treated for the pain as well as seeing a psychiatrist or a psychologist to help you make the pain go away, to get rid of the pain, to get rid of your pain? Do you need to simultaneously be seeing a psychologist or a psychiatrist? Does anyone think that that makes sense? What does that even mean? Nothing. But because of the fact that chronic pain is perpetuated globally, the talking heads of the world must have to say something to sustain their relevance. So instead of saying something like, I really don't understand this, I don't know, they make psychotic statements. This book does help the reader to gain a greater understanding of their musculoskeletal conditions and provide them with direct direction for self-management. While the book may provide some relief, the title, The Pain Cure RX, remains an ambiguous term. It is widely understood and accepted that there is no cure for chronic or persistent pain. Direct hit, checkmate, end of story. It is widely understood and accepted that there is no cure for chronic or persistent pain. By who? The idiots who are incapable of resolving your pain. That's it. He just said it himself. He and his comrades believe there is no cure for chronic or persistent pain because they don't understand the etiology of it. The etiology of it is misdiagnosed acute pain. So, is there an answer to acute pain? I guess they're okay with that. Well, if there's an accepted understanding that there's a resolution of acute pain, well, if you haven't addressed the acute pain for a year or 2 years or 3 years, and now you call it chronic pain, it's still the same cause. Nothing's changed. you see how sick this is? You understand how nuts this is? You strain your hamstring for some reason, and it makes it difficult to walk, and no one identifies you have a hamstring strain, and you're 2 years down the road, and you still can't walk, and you still have pain. You're telling me that at that time, 2 years down the road, this problem isn't still that you have a hamstring strain, and if you fix the hamstring strain, whether at its initiation or 2 years later, you aren't going to be fully pain-free? How can someone say? How does someone make these comments? It's clear. It's got to be logical to anybody listening to this. Okay, let's see. Where did I end? Let's see. This fails to provide persistent or chronic. This fails to provide the reader with a truly holistic insight into assessment. That's just so warm and comforting. What a warm and comforting statement. This fails to provide the reader with a holistic insight into assessment. Do you think the reader gives a shit whether I'm going to hug them or not? The reader's reading the book because they're in pain and they want their pain resolved and they want a diagnosis. And the diagnosis represents what tissue is in distress, eliciting the symptoms they're having. And the identified tissue had better be the same symptoms, create the same symptoms if it's in distress as what that person's experiencing. That's what they care about. That's why I get people better within a couple of weeks or a month or two, where the British Pain Society, who has probably never treated anybody, and if they have, they're more interested in giving you a hug than trying to come to the conclusion as to what tissue is in distress. So he says, this fails to provide the reader with a truly holistic insight into assessment, diagnosis, and guidance to self-management treatment of persistent pain. Failure to acknowledge psychological components such as mood, anxiety, and avoidance behaviors comprises the effectiveness of this book as a self-help guide for patients. Although Yass advocates a self-management approach, the use of the word cure in the title has the potential to provide patients with an unrealistic expectation of what can be achieved through engagement with this book. So as you could see, based on what I just showed, that review is pure, irrefutable dog shit. It is written by a guy or a woman who I could guarantee you I'll go one-on-one with them any day of the week, and I will get 99.999% of people treated out of pain, fully functional, greater than them. This is the reality of life. This is what exists in the world. The British Pain Society versus me. I just presented you with an understanding of why these types of organizations and these people will never get your pain resolved, while the Yass Method pretty much guarantees it will. Even if you had a structural variation, the diagnostic model will allow me to know that, and in less than 2% of cases, I'll be more than happy to refer you back to the medical system so you can get your surgery and be on your way and get back to a pain-free, fully functional life. But the other greater than 98% of you who are having pain, whether the pain is in a muscle, whether it's in a joint due to misalignment of joint surfaces from muscle weakness or imbalance, whether it's from a muscle referring symptoms, whether it's from a muscle impinging on a nerve that refers symptoms, those four muscular causes account for more than 98% of cases of people in pain. And I mean chronic pain. And if those four possible causes cannot show up on a diagnostic test, or there's no medical specialty educated or trained to identify them, I don't care how many people hug you. I don't care how many people want to know how you're feeling about yourself, whether you're anxious or depressed or not. If you don't get to the cause of the pain and resolve it, you're going to have those emotional distresses for the rest of your life. Now, the problem is, and this is my point, is that once you have that sustained pain and it leads to anxiety and hopelessness and frustration and maybe even suicidal thoughts, the emotional connection becomes much greater and you lose the focus on trying to address the actual cause of your symptoms. That's the scary part. That's the part that forces me to be so aggressive from the moment I start treating somebody. I know that they're basically a ticking time bomb the longer time has gone on. I know that they're starting to shut down in life. They're starting to not want to have relationships, to not want to work, to not want to go outside their house, to isolate themselves. I got it. I understand it. I've dealt with it for over 28 years. So we have to immediately, day one, within the first hour to 2 hours, we better have a diagnosis. And if it's muscular, the positive news is that, You no longer have to go to anybody in the medical establishment. You fix muscular problems. I guide you, I help you confirm it, and I figure out which muscles are responsible. But from that point forward, now it's up to you to do the exercises correctly. Make sure you use progressive resistance until the force output of your muscles is greater than the force requirement of your activities. You're pain-free, fully functional. So at one point, I basically become a guider and an overseer. But ultimately, you're going to take the responsibility and you're going to do it. So I feel better. I just wanted to get that off. I recently saw this again. And I was like, I gotta just put my 2 cents out and let people know why the Yass method is the Yass method. It is the only true, let me say it clearly, diagnostic and treatment model. It is not a treatment model. Lots of treatment models, lots of treatment models. Lots of people saying they're going to make your pain go away. You just got to do this without ever trying to attempt to understand what is the tissue in distress creating your symptoms. And if it is muscle, which particular muscles? Not all muscles, just the muscles responsible for the symptoms are the ones you need to address. And the only way to identify that is through a specific physical evaluation, which is at the core of how the Yass method works. So I hope this enlightens you, and I know I feel better. Can't help myself. So if you watch this and it's making sense and you're like, wow, this guy actually sounds like he makes sense. And yeah, I know he's passionate and stuff, but more importantly, he sounds like he has the path to helping me get out of pain. You can contact me by email. You could ask questions. You could see if it sounds like this is right. You can contact me at drmitch@mitchellyass.com. I'll have it in the description. And if you decide you want to make an appointment for a treatment, the good news is that I live in Jacksonville, Florida. You don't really have to come here. The Yass method is easily utilized through Yass method Zoom sessions. You can go to the website. Again, I'll have it down there in the description, www.livewithoutpains, plural, livewithoutpains.com/sessions. You could make an appointment for yourself at the proper day and time that's comfortable for you, and we'll work together and get you out of pain and fully functional. So for now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.